isn't this open? Oh, somebody's doing it.
Yep, got it.
Huh. I don't know what's going on here.
Okay.
Okay, so I think we can start now. We have more than our quorum that came on almost at the same time. Oh, let's see, that recording is going to the cloud, right? Is that right, Victor? Okay.
Yes.
Barry, can you hear? He may still be on mute, but hopefully it's recording.
Yeah, it's recording.
Okay. Good evening, everyone. Thank you for joining us. And let's make note that it's 6:35 p.m. and we are starting the meeting of the Health and Environment Committee with I believe I counted 6 people, and there may be more of our members. So we certainly have a quorum, which even though we don't need it to listen to reports or our guests, it's always good that everybody's on board to learn and hear the same thing. We have an agenda that I emailed out. Did all of you get something from Laquita Henry _1?
Yes.
That's the actual agenda, because there was a mistake with the initial Zoom notice. It sent out minutes from a notice of a prior meeting. So did you get one from me this afternoon?
I think so, Laquita. I'm looking right now.
It'll be from Laquita Henry _1 at Yahoo.
Uh-huh.
Oh.
Are you referring to this one?
Let me get my glasses on. Is that the one you sent, Victor? Because there was a mistake. Okay, so that is.
Yeah.
Yeah, it says today's date and it has the speakers for today, which look familiar.
Okay, I did recommend a change. That is the one. Thank you, Victor, because he helped me out a lot this weekend and sending this out. We are recommending reversing some things, the review and recommendations for the community board agreement with Columbia University is being handled through strategic planning, which Victor chairs. And he had asked us to make some recommendations and suggestions. And Victor is torn between 2 committees tonight, as is probably Barry. But anyway, Victor would like to go first, and then we can resume with our presentations. Can I have a motion for that
Motion
change
to
of the agenda?
motion to adjust the agenda so that Victor can speak first.
Yes.
Would somebody like to second that motion?
I'll second, Monique.
Thank you, Edwin.
Yeah, I noticed, Edwin, you something happened and you were knocked off the system for a minute. I'm glad you're back. Okay. All right, so that when it's time for presentations, we'll have Victor present first, and which will include all of the committee. The minutes, I emailed the minutes out also, and I want to thank Edwin for having recorded those at our last minutes. Was recorded and then he emailed it to me. But anyway, you have the minutes. I'm more inclined to believe that they are pretty much correct because they are exact as recorded. But anyway, we need a motion to accept with some corrections, I'm sure, with spelling and all.
Motion to accept minutes with maybe minor edits. Would somebody please second that motion?
I'll second.
See, we have,
Here you go.
okay,
Thank you.
We have Heather, can we hear you? Let's see, because I'm not sure. did Monica come in?
I see, well, Heather is unmuted
Yeah.
and
Heather is here.
Okay, and Solomon came in. Okay. All right. Thank you. So we'll
You're welcome.
begin. So we'll begin with a discussion on the CBA agreement. Victor, you can give us an overview because I noticed there are a number of new people who are part of our discussion. And then what we would like to do is to see how that how the components related to health and environment can be fulfilled. Victor?
Yes. Good evening all and welcome to board members and guests to the Health Environment Committee for CB9 on February. As was stated, my name is Victor Edwards. I'm the vice chair of the board. I'm also the chair of the Strategic Planning Committee. One of my roles for that committee in the past several years was to monitor the community benefits agreement between West Harlem community and Columbia University. This agreement came out of agreement between the communities for, put it bluntly, the eminent domain and taking of land here in West Harlem where Columbia is building the new university. So I always say it's a give back to the community for that and the inconvenience we've gone through as these buildings go up. In the end, I think it'll be a good thing that the campus is here as long as they continue to work with the community. So part of the agreement, this community benefits agreement, is a 50-page document outlining various benefits to the community, and quite a number of those are health related. There, within the first building it went up, which is the Jerome L. Green Science Building, there is a outreach clinic, for lack of a better word, to the community where they hope to study different diseases that are affecting our community in particular. What we can ask for different reports to be done and different studies to be done. One of the things they have been looking at is diabetes and strokes, something that definitely affects our community. They also have a dental clinic, mobile dental clinic for pre-K, ages 3 to 5. They have a mobile dental clinic for seniors, which travels throughout the district to different senior centers, which is, you know, they've been pretty successful with that. One of the things I wanted to see if I can share my screen. And for the board members, when you get a chance to look at the benefits agreement, pages 27, 28 cover the health portions. It's also online on our website, cb9m.org. You can go there, look for the CBA agreement, and it's 50 pages. You can scan through that and see all the benefits that.
Victor?
Yes.
Victor, let me just mention that if anyone has their access to their email, I did email that part of it that you had sent as part of the agenda this afternoon. So it was maybe around 3 o'clock, but I sent everything to the board members. So just look for it. It says Victor had put together the CBA health related items. So it's in your agenda packet.
All right. Hold on 1 second. I'm gonna see if I can share my screen with you. Hold on 1 second. So when you get a chance, whether you're on the board or not, you want to take a look at that document. It will outline some very good things. They do have an outreach team that works out of the Jerome L. Green Science Building that does go in the community and try and do outreach. They've worked through churches and other various organizations to try to educate people on better health And second, nope, it's not. Let's call. If I can share my screen.
I can share Victor if you want.
Okay.
You have reached 1930 at the tone. Leave a message. Thank you.
The screen is shared,
Oh,
Victor.
thank you.
Yeah, I see it.
Yes, there we go. Thanks, Edwin.
You're welcome.
So these are some of the highlights of the health-related items that I've kind of cut and paste throughout the document. They're located in different places. But as you can see in item G there, they talk about the Jerome L. Green Science Building and the screening education piece. So it's, as with most of the document, it's a 25-year period. So we still have some time within this time frame to take full benefit of it. As I've said in my prior meetings, if we don't ask for it, we won't get it. It's not up to Columbia to press some of these things. They put them out there. And you'll notice.
Oh, did you freeze?
Did I freeze? No, I don't think so.
Hello?
So you
Something, it's a break, it's some breaks in the call. Okay.
So you'll notice like on item F there, right? Seniors upon request from the West Harlem Local Development Corp., which is now the West Harlem Development Corp., will provide advice to seek identities and raise funds to support senior programs. But the key here is upon request, right? If we don't request it, it's not going to happen. So
Right.
we have to get together and decide what we want to request to be have done as a community, as a board. I've spoken with the interim executive director, Ziad Ramadan, regarding this, and he's open to discussion. And we can take a look at this. So I thought that a study would be crucial to see what diseases are affecting our community mostly, which we, from our own knowledge, diabetes, high blood pressure, things of this nature have affected us greatly. And I saw a article, I say about 6 months ago, about how COVID was affecting our area and public housing in particular, that the death rate was much higher in public housing than it was often outside of that. And it related that to underlying diseases and existing diseases that are already there. And this just compounds that when COVID came along, right? In addition to that, is not getting proper care and proper screening that some people can't afford. Medical is often expensive, but there are free things, and we want to utilize as best we can Columbia to help us with that.
I think if we add, Marita, I'm sorry, you were going to say something, Marita?
For me, Marita, no, I was
Okay.
Just listening.
Okay. I was just going to add mental health when you asked Victor what did we notice in the community. I think it's a great deal to be said about what we see in terms of mental health issues. I don't know if and then drug abuse, that fentanyl and all of that, I'm not sure if that would be included.
We can ask, like I said, it's often just an ask. We need to let them know things we're concerned with and ask. I was on a call this weekend regarding cannabis. We formed a cannabis task force just recently, and I was on a discussion with the organization 100 Black Men regarding cannabis and how the dispensaries coming to our communities, how we would benefit from that, and licenses being given to people in the community that were previously affected by the cannabis laws have now changed and not predatory people coming in and taking advantage. But by the same token, I mentioned to them that cannabis, as I see it, along with alcohol, is often a self-medicating treatment. We have to be careful when things are legalized that we don't encourage our young people to self-medicate when mental health professionals are the ones that are really needed. Often in my prior life, I was a drug counselor in the public school system. And I saw where young people would start out with, say, marijuana and then increase to something stronger because it wasn't providing the same effects and relief that they had in the beginning. So now I'm doing cocaine, now I'm shooting cocaine, now I'm doing heroin, right?
Yeah.
As with alcohol, anything in moderation is good, but when it's abused and used for self-medication, which is not intended for, it can be a hazard, as we've seen in our community with all types of substance abuse. So I just try to get a balance between the two. I don't have it here, but there's an implementation checking device where Columbia has to submit to the state every year how they're complying with the community benefits agreement. And on that, like the dental care, they show which community centers they've gone through, which preschools they've gone to, and how many clients that they've serviced, which I thought was a good thing. Same thing with seniors. They show where they've gone, which centers, and that tells us who they're serving and how we might want to change that. In the past, I've been in contact with Columbia to make sure they've gone to the Jackie Robinson Center at Grant and other centers. So that's something we can take a look at. During COVID, they suspended their in-person visits. I don't know if they've started them again, but there is a chart I can forward to you, and I don't have it at the moment. I can't bring it up on the screen actually, but it will show you what visits they're making and who they're making them to. When they visit the senior centers, they do a pre-dental screening. They also do blood pressure, and they will make referrals where needed. I know Jackie Robinson and 3333 was one of the biggest places they visited, but I'd like to see that expanded, throughout the district.
Right.
Right. And
Yes, right.
so that report that goes to the Empire State Development Corp is key to them complying with the community benefits agreement. Okay. Any questions on anything I covered thus far?
I would say, Victor,
Yes.
if we can try to look at some of these acts from to Colombia, looking at the Maslow hierarchies of needs, because that plays a big role. Where people live matter, and it goes to the fundamental, basis of these other symptomatosis that we see with drug use and other illnesses, hypertension, diabetes, distress. And they are the biggest landlord in our community. So there is an intersectionality that takes place with housing condition, and these stressors that we have to deal with. So they have the manpower to help us understand that. And the literature is coming up more and more that where you live matter, not only your zip code, but also the conditions of your housing.
Yes.
Okay. Something we can combine with our housing committee to take a look at as well.
Yes. Yes. I sent
living
an article.
Go ahead.
So I sent an article to, I don't know if I sent it to you, but I sent it to Bailey and Laquita for sure. That talks about, they look at, the stove and the emission of gas that it produces in your house and how that impacts the environment. And indeed, that has long-term effects when we talk about, on people's health.
Gotcha. All right.
Yes.
That's good to combine with, what we're doing, what's written, and that outreach center. I spoke to someone at the outreach center, but he recently retired. He was going to get back to me and see who the contact person is now and see if we can coordinate and have that person come and speak at this committee about environmental impacts as well.
Is that Harmon? You talking about
Correct.
Victor?
Yes,
Edwin, do you
Harmon Moats.
know who? Yeah, do you know who's taken over that area, Victor? I was gonna ask Edwin if he's aware of who may have taken over Harmon Moats's former area at Columbia University.
I have no
School of,
idea. But I know that
I
Robert
think it's the public health.
Probably
Robert Fulilove and Mindy Fulilove, they did a lot of this work looking at how housing impacts HIV and the CD4 count. And they were able to demonstrate that if somebody was unstable in their housing, that had an impact in the transmissibility of HIV. HIV is a communicable disease, but it will be no different for somebody who's dealing with diabetes, hypertension, depression. So if they found the strong linkage between these two illnesses and housing, the others exist. I do research with diabetes and housing. The literature there is building up now, but we can take advantage of having such a big institution so they can help us help the community with these stressors.
Sounds great.
Sounds good. Yes.
Hi, if I could say something quickly, please.
Yes,
Just a minute.
hi.
Yes. Good evening.
Hi, my name is Marines, and I actually was able to take the recovery coach training. So thank you so much. And also, I too was a drug prevention counselor in high schools,
Okay.
and I've been in drug prevention for a while. And I've made the I guess the journey and the transition to more holistic approaches. So I also do Reiki healing, I do sound healing, and I'm trained in transformational hypnosis. And I used to actually be a bartender in Harlem, and now I am a resident under a different circumstance. And I've seen how the community changes. And I feel like as I hear us talk, I'm a psychologist, I have a bachelor's in psychology. And when we're talking about Maslow's hierarchy of needs, something that I also want to talk about quickly is when we're looking at the types of intelligence, the multiple intelligence theory, which I didn't know for that long.
Marinez,
yeah.
Marinez, we're gonna have a session where you'll be able to talk about what you do. It sounds fascinating. Right now, how will it relate to the community benefits agreement?
So what I was thinking is that if we're using Columbia to provide like funding or assistance, if we're talking about Maslow's hierarchy of needs, we could also use the multiple intelligence theory, because often IQ tests are made more for, as we know, people that are white or also have a different upbringing, when natural intelligence will apply a lot more to our type of people. And for example, put money into that. And then that also solves some of the environment issues, like helping to fund educating and fulfilling people that have a naturalistic learning method, or interpersonal or intrapersonal, which usually our people are much better than your average white person when it comes to associating on one-on-one or socially. So I just wanted to add that.
Will you
Thank you.
stick with us and so we can hear more about this a little bit later? Will you hang around for a while? Okay. Victor, you were going to add or comment.
Okay, yeah. So that, I can come back whenever needed. We can explore this a little bit more and see what ask. A lot of it, like I said, goes to West Harlem Development Corp, right? So we need to put together what we want to ask West Harlem Development Corp to do with Columbia, what our ask to be for them. So that's something we need to think about. Like I said, take a look at those sections in the CBA, what kind of assessment we want to have done, and then we can move forward with meeting with Azia Ramadan, who's the interim director right now, to move forward with those type of assessments. And we'll get someone from the other center at Columbia as well that took Harmon Moat's place to speak with us. community outreach group.
Victor, can I make just one quick comment?
Sure.
When we reach out to, I guess when the community board reaches out to Columbia,
Mhm.
just sending data upstate to say that they went somewhere is one thing. What flyers did you put out? How did you outreach to the community? Okay, because you could say you went there and said only 25 people showed up, but if you never did any outreach and real outreach, because I've been an organizer, what, 14 years now? You got to
Right.
hit the ground. You got a flyer. You got to call. You got to make it known that this is happening, because I grew up in public housing. I grew up in Grant. If you don't put those flyers and come to us, it's not happening. People just say, "Oh, we came." Nobody knew about it. I just want to just make sure that they do that.
Thank you, Bailey, for sharing that. That is 100%, 200% correct. One of the things that the report I was speaking about also shows in certain cases what efforts they made to let people know. The other thing is, I've said it in this meeting and other meetings at the community board, it's also up to us to get the word out. I spent part of my afternoon this evening at Manhattanville putting flyers up for a meeting this Wednesday, and just to get the word out. And often, you're right, they had a meeting. Oh, we had a meeting, no one showed up. Well, who did you contact to try and get the word out? Did you flyer the buildings? Did you stand on the corner and give out notices? It's great to say on paper what I did and who didn't show up, but you're 100% correct. That's something we all need to keep in mind.
That's one of the toughest things.
Yeah, go ahead. No.
That's one of the toughest things is the outreach. And I realized I did have it one time. I think I have initial, some of the paperwork, some of the tenants associations.
Mhm.
And that might help us as we put forth our ideas too, in terms of
Yeah.
community benefits. The tenants association. So yeah, outreach is critical, as well as outreach to some of the HDC, West Harlem Development Corporation's grantees and their followers, or the people they're reaching out to, because we have to find a way to get the word out more. And so those are two ideas that I'm thinking about. Thanks, Lou.
Thanks, Billy, for that. That is good. The outreach is
Yeah.
important, and by all means necessary, whether it's the grantees, whether it's resident associations, whether it's whoever, meeting people where they are is what I always think of. So whoever the people on this call that are guests that can help with that type of thing, we can rely on them, whoever it is. Churches or other organizations will certainly help.
So I put on
Right.
on the chat, the CDC has different tools to do community health assessment. These are different roadmaps that you can do based on whatever intervention is that you're looking for. And it provides us a framework that can allow for these things that we're talking about to be assessed. And then you can pinpoint where, you need to do some certain changes. So I would encourage everyone to look at it, look at it with the CBA and think about which one you feel goes more, with the work that we're trying to do in our community. And then that is something that we can use ourselves so we can measure the intervention that we're trying to get done.
Excellent.
Right.
Excellent.
At this time too, before Victor leaves, Victor had a meeting in January of the Strategic Planning Committee, and the Health Committee really turned out in strong force. Most of the committee, as a matter of fact, and it was an excellent meeting. Going forward, we need to make sure that we have a couple of representatives at all of the strategic planning meetings. I was thinking about a couple people on our committee now. I'm not sure who might be interested. I think we can all attend, but just to make sure that we have a couple people there at all times. Are there any persons who are interested in can make themselves available the 3rd correct me, is it the third Tuesday of every month?
Third
Victor?
Tuesday, it was the third Tuesday of every other month, but
Every
I'm
other
probably
month.
gonna change it to every month at this point because we have so much to cover.
Mm-hmm.
So I will send a notice out with the new dates shortly. And you can
Okay.
rotate, the people who come, as long as they bring the information back to your committee. They can rotate, or as many as one can come, but as long as you have someone there, because health is one of the bigger things we need to take a look at.
Great.
Health and environment.
So is there anyone who wants to volunteer right now for this February meeting that's coming up, who would be able to attend on behalf of the health?
I'll do the
Two
February
people.
meeting.
Let's see, is that Edwin's hand up?
Yes.
Is that Edwin? Okay. I was gonna ask Solomon as well.
Yeah,
Edwin,
you can sign me up, Laquita.
Oh, there you go.
Okay, that's great. And then as we just said, everyone can attend the meetings, all the board members can attend, but it's good to have, those specifically representing health and environment who can come back and report to us. So just let us know. And if either of you cannot attend, just, let me know and we'll see if there's someone else who could just substitute for you on that particular occasion. So this looks good. Solomon and Edwin. That's great.
All right.
Any ideas, anything you want to put forth with Victor? Any other comments?
There is a
about-
section on environment, smaller section. A lot of the environment piece has to do with Columbia's impact on our community as far as greenhouse effects, their building, pest control. It's a smaller portion. We can discuss that another time. The health thing is bigger. Ms. Dunn, are you still on the line? I had a question you might be able to help me with.
Yeah, Marita's still there.
Oh, okay.
I'm here.
Under the environment, there's a provision for the West Harlem Piers to receive money each year. So I just wanted to know if they report to us or to the board on the money, funding and how it's spent.
I have not been able to get Parks to say. What I do know unofficially is that Parks has taken the money that was specifically for the West Harlem Piers and use it throughout other parks issues.
Really?
I have made several attempts to have them tell me what these funds were spent for and when.
Okay.
And the then commissioner is no longer there, and I have not gone and addressed the new commissioner as of yet. But we have.
That happens every year. They do that, Marita. Every year they take money from. Yeah.
So with the new commissioner, I'd like to help you reach out to find out. I think the initial payment in 2008 was $500,000, then supposed to escalate 3% annually for the
Right.
next 24 years. So
Yes.
we can put forth a memo together to the commissioner, CC Mark Levine and Shauna Brew for a formable accounting of these funds. It should be spent right there in West Harlem Piers, not throughout. That's what I'm
Right,
reading.
'cause it's clearly
That
marked
sounds great.
dedicated funds in the community benefit agreement. It clearly states dedicated funds specifically for that. Okay, Victor, so
Okay.
I accept
Great.
your offer. Let me know when you want to get together and it's good to go.
Okay. Sounds good. Sounds good. Well, I'm going,
And
any
then-
questions? Because I have to jump on another committee meeting for the board anything before I go. I thank all board members who are here, and yes, if I can jump back on, I will definitely do that as well. All right.
Okay, thank you.
Have a good evening all. Talk to you soon. And thank you for the
Thank
guests.
you,
Thank you,
Victor.
Victor.
Welcome.
And I know Monique is still on. I know you are interested also in strategic planning. So as we said, I know you'll be a great representative too, but I know you are also, just so the committee knows, Monique is co-chairing the cannabis special task force with Miriam Aristide Ferrer. So you two are gonna be real busy with that, but you're both on the health committee, and if anything comes up that we should know in terms of cannabis, you'll keep us informed. And same thing with strategic planning, be available to represent us there too at any point. But again, Edwin and Solomon and Monique, and I know I'll be there as well. Okay, so moving forward, I don't know if anyone is here from New York City Department of Health, Mental Health. If not, I mean, they had a wonderful presentation on COVID, and I included it in the last, it should be the last email with my name, Laquita Henry _1 at Yahoo, where I included the charts and graphs. I think for the most part, as Pat Moore John, who's also a member of our board on leave and a former chairman, stated, our numbers are pretty good in the area codes for zip codes rather, for Central Harlem and Upper Harlem, but there are some areas for improvement. And because I was expecting him to be here with that discussion, I didn't really review it beforehand. But Edward, is this, you put this on the board? Case rate per borough, but he had done something specifically for Manhattan. Patmore, by the way, is now acting acting deputy commissioner for Harlem neighborhood, the Harlem Neighborhoods District. And it's a long title, it's more to it than that. So we congratulated him at this last meeting on that, and I'm sure we'll hear more about that. But on the board, did you have a chance to look at and study it? I know that, Edwin?
No, but you know.
No, so but the charts and all, and the way they spoke of it, bottom line is, for the most part, 70% and above 70% of our Harlem areas are vaccinated, but we still have a high number who are unvaccinated. And the reason seems to be a belief that the vaccine will diminish them somehow in terms of fertility, and primarily fertility. So that's where we are with that. And they still are interested in trying to get more people vaccinated. So if you have an opportunity, please go to the PDF that I included in the last email that shows these charts by zip code. And I'm hoping that someone from DOH will be able to come in at another point and give us additional information, but I believe that that's primary. So we're not doing too bad. And our hospital rates are down, but there's still room for improvement. Can we move to see, Edwin, is there something that you, this is what it will look like. This is what it will look like when you go to the chart. So you'll have an idea. They're trying to get more scheduling of the pop-up buses, the locations as well. And they're having a hard time with that right now. But they know that the community wants some continuity, some stability with that, where they can just go one place or another and know that they can get vaccinated, particularly in the Central Harlem and West Harlem areas. Okay, thanks Edwin for pulling that up. Let's move on to Louis Bailey of We Act, who is going to give us a review and an update on really well done heat and flooding meeting that was held a couple of weeks ago and sponsored by We Act. Lewis?
Good evening, everyone. Excuse me. My name is Lewis Bailey. I'm the manager of membership and organizing here at WEAC. Thank you, Laquita, to Edward, and Victor, and also to everybody on the board. So briefly, I'm going to talk about two things. The first is, as Laquita mentioned, WEAC, along with the East Harlem COAD and City College, are developing an emergency preparedness kit and outreach plan that covers all 4 of the Northern Manhattan community boards, which is 9 through 12. So last week we met to discuss what are we going to need to do in case of another flood emergency or heat emergency. We know who are the vulnerable populations. We're talking about kids, seniors, those with medical illnesses. But as we saw with Hurricane Sandy and what it did, Hurricane Ida, we saw our subways flooded up to our knees and almost hips in water. How are we going to address that going forward? So the initial conversation took place to just dive into that. Who do we need to reach out to? How do we need to reach out to them? What resources are going to need? What city agencies need to be involved? So we want to be able to bring the whole Northern Manhattan community together to discuss that. Now, the meeting that was scheduled for Thursday this week has been postponed because some of the agencies could not be on the call, which was going to be Thursday at 6 p.m. But I will update the community board about what the next steps are. But this is the initial conversations we want to have to make sure we are protected, especially every summer we go through it. Heat waves, no access to the cooling centers. The cooling centers have moved. All of these different things are just, it's just the same thing goes over and over again, but we want to be able to address it better. So again, I apologize that that meeting that took place, that's going to take place supposedly for Thursday, has been canceled because we could not get the city agencies to come. And we want to let them know what the community has been saying about what's going on regarding heat illness, heat disparities, cooling centers, and also the flooding that happens when we have torrential rain. The other thing, Laquita, do I have like 3 more minutes to talk about the other issue?
Yes, please.
Okay. Back in November 2021, WEAC, along with the New York City Council, passed Intro 455, which is Local Law 120, that mandates that school buses be electrified by 2035. As we know, buses are a primary source of air pollution, and developing children are especially vulnerable to the negative health impacts of poor air quality. Now, this bill is very important. I want everybody to listen to me. The Department of Education has to report to the mayor and the council regarding the implementation targets. Now, by July 2023, July 2028, and July 33. The mandates are that by 2023, we have 75 electric school buses. I know that's not a lot, but it's a start. And by 2028, we'll have 20%. By 2033, 66% of the city school buses that our kids use will be electrified. Now, the current—
And how is that how are they looking at that by district? How many say in the Harlem schools in the Harlem area or servicing the Harlem area? How is that broken down?
We have not gotten that specific data yet, but when we do, part of it, and I'll get to the part of the coalition, what they're going to do, but part of that is to ensure that communities of color get those buses first. We already have, or we had 5 bus depots, MTA. So the last thing we need is more pollution in the community. So we want to make sure those buses are allocated to our community first before getting out to some other bus, which they all are in need. I'm not going to say they're not, but Northern Manhattan is what this coalition is advocating for.
Very
So,
good.
so
Marita?
Yes,
So I just want to.
Oh, you know what? Okay, I'm sorry. I
thought.
thought Maria had a question. Her face pops up.
Oh, sorry.
I was like, okay, go on,
Current
Louis.
administration is ensuring and advocating for the prioritization of environmental justice neighborhoods like Northern Manhattan. And WEAC is going to be a part of the local, state, and federal levels to make sure that happens. There is a steering committee, the New York City Bus Coalition. They're going to advocate also for state, federal, and local funding for EV charging stations and electric school buses. And these targets are going to be broken down over the years, okay? So we will be convening some important stakeholders such as parents, bus companies, and contractors to make sure the transition is smooth. You know, the other thing we need to worry about, where are these electric charging stations are going to be placed along the routes, especially in historically overburdened and vulnerable communities. So we don't want one on the east side of Harlem and then have just one on the west side of Harlem. We wanted to make sure that the routes these buses are taking, they have these charging stations so they don't have to go across town. So there's another steering committee called the Alliance for Electric School Buses. This is a national coalition, and they'll be advocating also for the development and design and implementation of this new school bus program that's going to be rolled out. And that's part of the $2.5 billion Infrastructure and Investment and Jobs Act. So as this is rolled out, we will update the community board, make sure that you know, hey, this is what's going on. There's meetings. The two people that were supposed to be here could not make it from the staff. So that's why I jumped in, but I promised Laquita that we would have and represent here with the community.
Thank you, Louis. Are there any questions?
Yeah, I have a question. Louis, have you heard anything about charging station for electric vehicle in CB9?
I have not heard that yet. The placement is what I think is the next part of what the Alliance is going to do, like where are they going to place it? Because as
It's
we
like
know,
where the bus depots are, maybe around just where the bus depots are.
it could be, because Amsterdam, as everybody knows, is a bus route. You see all types of buses, much less the city ones, but it's a truck route as well. So we want to make sure that they're strategically placed. So if a bus is picking up kids from 169th, that they don't have to drive all the way to like East Harlem at 115th to get it charged up. We want to make sure the route coincides with the charging stations. But I'll update everybody as soon as we have more information.
That's interesting.
Very
Any
good.
other questions? I don't know if any other hands are up.
But I would say to the board, everybody on this call, I've been doing my own little backstory research. I'm advocating for the charging station where it's like a pad, where the bus just rolls over a pad like that's on the street, physical street, and they can charge rather than having to charge into an actual plug, like, you know, like electric.
Oh, like the computer, like a iPhone, like you plug in your phone, your cell
Right,
phone.
like
a
a cell
flat
phone
surface.
pad on the ground. You know, there is technology for that. And because I know the MTA is looking into that. So there's a lot of things to look into, but I'm hoping that we can get information to you as soon as possible.
Wow.
Wow.
And Louis, would you reiterate again? I think there's a law that's coming into play where the city is mandating that certain housing units are converting from gas to electricity
I don't know.
in their
yeah.
buildings. Are you familiar with that?
No, I am not. I know about our own pilot program, but I'm not familiar with that. I would have to look into it. But I know.
Someone did mention that, I think in our last board meeting, there was someone who made a reference to that. At least I thought it
regulations
was.
coming for 2024 that no new gas hookups in any
Yeah,
coming. So, but I've not heard it in housing. I've never heard that.
yeah, for housing under, I think, under 7 stories or something like that. Okay.
Yeah, I have heard, and it may have been also on television as well, one of the news programs, and they were talking about how they wanted to make sure the NYCHA houses were included in that. One among some of the first. Let's see,
Yeah,
what's the-
with all new construction, and then certain buildings within the next couple of years will be converting to all electricity.
Solomon
Okay,
seems to, in the chat,
thanks.
responded. I didn't mean to cut you off. I wanted to add to what you were asking about, Heather. It seems like Solomon has in the chat something on banned gas in new buildings, what to know. So
Okay.
Okay, thank you.
And
Uh-huh.
so just one last thing before I close, and thank you again, Laquita. If anybody's interested at our Saturday membership meeting, we'll be talking about not only the out of gas pilot program, but we talk about what are the next steps, because there's this myth about gas, that it's so friendly when it really is not. If you don't know, when your stove is off, it's still on, emitting stuff into the atmosphere inside your home. So even though
Yeah.
you're not cooking anything round the clock, and we're all home just about all day long, those embers are just emanating into the space. So just want to know that. I'll put the link in the chat if anybody's interested. Saturday, 10 a.m. to 12 p.m. we'll be talking about that project and what we're going to do going forward.
Okay. And Louis, there was something I know you were discussing with youth about the e-bikes. Is there anything you recall? I know there have been a number of accidents or mishaps with the e-bikes. I'm not sure if you recall.
Yes,
But
yes.
okay. I don't know if you have remember what you were going to add in reference to that. But
I
there have
was
been a
just
number
going
of
to just
accidents.
bring it to the board's attention. There is a website that I monitor for the fire department. So it gives me a list of where the fire was, what the cause, who responded, and all of that. There've been a lot of e-bike fires throughout the city. And I just wanted to bring it to the board's attention that maybe we need to look into that, because a lot of the people who deliver our food and all that, they're not using the top end electric bike. They're using a knockoff. And once you charge those things up, if you leave them overnight, they can explode. And they're doing it can explode, immediately, and then they have to the fire department has to bring a hazmat unit, because you just can't put that out with regular, you just have to put it into what they call a drum. They have to take the actual charge and put it in a drum, encase it, and take it off the premises. So I just wanted to bring it to attention that I noticed a lot. There was one in Grand Houses a couple of weeks ago, 3150, and there was one in Manhattanville. So not just public housing, but they're happening around the city. And I just wanted to bring it to the attention.
Wow. Okay. It's a lot of good information. Do you think that any of the things you mentioned that we act as participating in would require a letter of support or a letter of endorsement? Not now, I know, but is there something that sounds like it might be gearing up for that? Because we definitely will need to be kept abreast and kept up to date so that it wouldn't be something at the last minute trying to get a letter of support for. It may have been the first thing related to the first, not heating and flooding, but anything that you think of, just keep it in mind that you keep us abreast so that if there is a need for a letter of support or resolution, we can be prepared to, have it discussed and presented in more detail.
I would say, to answer your question, the second thing I spoke about is the out of gas. I think that is a more pressing issue because, Edwin, to your point, the home is everything. And when the home is, and I've worked social services, in many shelters, and the home is where it all happens at. And when it's all disturbed for whatever reason, all the other things just cascade, downward. So if we could get a letter of support regarding that out gas pilot, just saying, hey, support the idea. And it doesn't have to be like right away. We talking maybe like March or April. We would appreciate it.
And you'll help us in the drafting of that through and keep us abreast maybe the next month
Yes.
where that's
It's
headed.
also important to know that in the winter, you have your windows closed. So where's the gas going? Our lungs are doing all the jobs for this pollutant that we have in our home. But yeah, we'll work on it. We have the draft. We'll massage it.
Yeah, yeah.
Okay.
And I just want to say one last thing is the fire that occurred in the Bronx. I'm just troubled that the city continues to blame the victim when it was about heat. People are going to do what they have to do to heat their homes. So you're blaming them for having these heaters when they weren't getting any heat. Yes, the issue of not closing the door played a factor, but most people are going to use their either stove or electric heaters to keep themselves warm. And they keep pushing that narrative. And yes, a lot of people died, 17, but they should not be blamed for the situation when the city or these landlords are not providing heat on a regular
Yeah.
basis. Going through this every winter, there's always a heat-related fire.
Yeah, we saw the blaming the victim.
Yes.
At different stages. Those who wanted to get heat, those who were escaping the fire and the door didn't close. So at each of these stages, there is a neglect from the landlord, blatantly. How can you tell an 80-year-old or somebody who has a newborn, don't heat yourself? I mean, that's just not going to happen. But yeah,
I just don't like that narrative of keeping blaming people for the situation of substandard housing. And that's what we should call it, substandard.
Absolutely correct. Absolutely correct.
Thank you so much, Louis. Any other statements, comments, or follow-up from anyone? There's a comment here in the chat. Let me just see. Oh, Heather just says thanks, but there are the other articles in the chat from Solomon on the gas stove heat ban.
And
Okay.
thank you again, Edwin, too, for sending me those articles. Those were great. And the team has them as well. So thank you so much.
Yes, Edwin sent those. Yes, yes. Thank you, Edwin. I don't know if Stephanie McGraw is here from Warm. I don't see her name, but there are other names I don't recognize.
She looks like she's here, Laquita.
Yes,
Okay.
hi, good evening.
Okay. Let's see. Stephanie, and well, the next two presentations are from awardees, grantees from the West Harlem Development Corporation. And I'm so glad that they were willing to come and speak. Stephanie, I learned of at the last community board meeting, and Reggie to follow. I've known a while, but I learned about this organization this past week. And West Harlem Development Corporation has awarded about $170,000 in grants related to health and human services. There are 10 in that 2021 cycle who were awarded. And so tonight, this will represent at least 3 of them that have come before the committee, which they have all been asked to do. And I'm so glad that these are following through so we can be kept abreast of what's going on, what their thinking is. I also wanted Stephanie to be part of what I think that might be very well a series of conversations dealing with mental health and mental health in our community. And Louis sort of ended us in a way that with an issue that also applied to police in the recent incident who were shot and unfortunately killed, and who, notably did get a lot of, and deservedly, a lot of recognition. But that same recognition did not go to the mother of the shooter, who is also a victim. And so for whatever reason, there's a lot we still have to deal with. The issues were domestic violence, mental health, whatever. And we just need to have that discussion in our community board. And I know Edwin has brought it up a number of times as well. We need to see how we can assist, what it is that we need to know and be able to help tackle. Stephanie?
Yes, thank you so much for having me here, Laquita, and thank all the committees and Community Board 9 for giving us an opportunity to expand our reach, and also, knowledge is power. We're dealing with very critical times at this present moment. So we. Oh, hello.
I can hear you.
Okay, wait a minute, I did something. Okay.
We
Yeah,
can hear you, okay, I think.
Okay, great. Yeah, so we can use, all the help we can get at this time, especially in the community of colors in the Black and Brown and Latino communities, where there are so many deserts, not just food deserts, but mental health deserts. We have poor school systems in some of our communities here, and right here in Harlem, where it's such a diverse community and there's so much wealth that's coming into the community. And we see all the gentrification, and we see all the new chic stores and new beautiful buildings coming up. But there is a whole community that's just being completely just alienated from some of these great pluses that's been put in our community. And I want to thank you so much for also allowing me to come on to talk about this mental illness and domestic violence. And what the gentleman talked about earlier is so true. When the home is disturbed and when the home is not properly serviced, then you're going to get all kinds of issues coming out of that one home, especially if you have a mother that's not getting her needs met, and that she has children. We were at a meeting one time and this woman said, well, domestic violence is not my issue because it's not happening in my house. And I simply said, well, if it's happening in your building and if it's happening in a community, it is all of our issues, because what happens in that household when those needs are not met, they spill out into the streets. We have gun violence, we have domestic violence, teenage pregnancy, we have the gangs, and we have robbery. So all of those, where the home is broken, all of those children just, come out to the community. But I want to highlight what happened with the two officers, Mora and Rivera. And both of those officers, I knew. I serviced that's one of my partner precinct, the 3-2 precinct. That's where I actually started doing my major work there. That was my first precinct that I was able to secure a partnership with, and it spread it out to 10 other precincts. So I knew those two young men.
Ms. McGraw, Stephanie, can I ask you to hold 1 second? Just hold. Is there anyone, I know in the chat, there are a couple of people who have problems with the sound. Has that been corrected, or can that be corrected, or have you corrected it? Is anyone still having a problem? I just read in the chat where Indiana, are you still having a problem, Indiana?
Come in Wednesday. Gigi tomorrow. Yeah, I hope Gigi tomorrow.
Okay, let's keep going. I'm sorry, just continue where you left off. Ms. McGraw, you can continue. Thank you. Sorry about that. We want to make sure everybody hears you.
She's muted.
Okay, Stephanie,
You're muted. Stephanie, you're still muted.
Hey, Stephanie.
Okay.
Hi, Stephanie.
Okay, she's out now. She's out.
Okay.
Yeah, I'm sorry. I had
Yeah, I wanted to make sure everybody could hear you because I know Indiana said something happened. Okay, go ahead. You're muted again, Stephanie.
Yeah, for sure. Yeah, I'm sorry. I had another commitment. I just had to say hi. Yeah, so I wanted to talk about
The two officers.
the recent death of the two officers who I knew personally, who I did roll call with, who I poured in my services to the 3-2, because unfortunately, when the pandemic started, I think they were the second highest in the city, with the uptick in domestic violence and all of the reports that were coming in. The 3-2 precinct had a critical problem, so they called me in, and that's how my partnership started, and it was very successful, and it still continues to be successful. However, those two officers, I remember talking to them and telling them how dangerous domestic violence is. And it's one of the most dangerous calls that an officer can go to, because it's a matter of the heart. And we are still, to this day, right now, still not taking domestic violence very serious. We there's a lot of emphasis on the gun violence, God bless them. No separation to me. Violence is violence. We have a lot of African-American, Latino women that's being murdered by guns, and it's not really being highlighted. But the connection between domestic violence and mental illness is it's a very serious issue that's not talked about a lot. It's just like the gun violence. But those two officers went to that home on a domestic violence call. And, they had no idea, and they did all the right things. They knocked on the door. They just wanted to talk to the male that was in the back in that room. But unfortunately, they walked into sudden death because he committed suicide, and he had a lot of mental illness going on. But one of the things we don't have, and I've been talking to all the local politicians, people at the mayor's office, we have too many bodegas. We have bodegas on every other corner, and there's no resources here in our community for mental illness, for clinics. We need to just remove some of the bodegas and make some of those corner stores stop-in resource center for people that are dealing with mental issues. And then another thing that cripples the Black and brown community, and even my household growing up, I want to go back 400 years of captivities. When our ancestors were relieved from captivity, if there were no therapists, there were no psychologists, there was no one there to help them through that trauma. So that trauma is in it's in us. And I say us, I'm including me because that's a part of my history as well. But there's no real resources to deal with that. And in my household, what I was told growing up in the Black family, that Black people don't go to therapy. And this is what I heard in my house as a child. Only white people are crazy. What happens in the house, stay in the house. And that is such crippling to our community. And a lot of us, we still have that kind of mentality. Oh, we got to keep what we're going through. We got to keep it to ourselves. We can't go get no help. So, we really encourage people to get help. There's a place on 135th Street. It's a vacant building. No one's in there. And we have been trying to obtain that place. It's right on 135th Street, right up the block from where that mother was that made that call. If we had the center open for these Black and brown and Latino women to come to, maybe they wouldn't have to use 911 for everything, and making it okay and accessible to say, if you need help, go get help. If you need therapy, if you need to talk to somebody, the help is there. But the problem is that there's not enough resources in our community. And the majority of the perpetrators that we have dealt with, a lot of them have mental illness issues that was never addressed. So, it's a combination. And then, some of the women, some of our clients that come into our agency also are suffering with depression. Those are all signs. That's mental illness, but those are things that are not being addressed. So what we're working on very hard. We did partner up with Yeshiva College. I think that's on the upper. I think it may be on 181st or somewhere in that area. So Yeshiva College is coming in now, and we're going to start having open clinic for mental illness for anybody, all free, for anybody that wants to come in, that wants to talk about whatever they're going through. We want to make ourselves open and accessible to talk about mental illness and domestic violence, because the whole situation that happened with those officers, it still wasn't a lot of talk about domestic violence. First of all, that was a call. And then no one was talking about the mother or what she was dealing with when she made that call, because she was actually afraid for her life. And unfortunately, because these two officers were murdered, that took like more of the highlight.
Okay, something happened.
Hello?
Something happened.
Hello?
Hi, I'm here. Can you hear me?
Yeah,
How do we get this?
So we hear you.
yeah, we hear you,
Hear you, Laquita.
Stephanie. What's wrong, Laquita? Oh,
What's the
It
matter?
might be her internet. Go ahead, Stephanie.
yeah, keep going, Stephanie. Yeah,
Oh, okay. Yeah, so
Okay,
thanks.
something happened. Okay.
yeah. The internet connection's a little unstable, but go ahead.
Yeah, it is.
Stephanie.
Okay, I'm glad to hear you. Your voice was the first I heard, Monique. Come back. Okay.
Oh,
Yeah,
All
well, I
right.
got kicked off already, so. Go ahead,
Yeah.
Stephanie.
yeah, so
It
thank you.
froze, Stephanie, just so you know what happened, but I don't think we missed, it froze at right I think at a point where you had completed that sentence. There, can you take a couple of questions and you may, and add to your statement? And can you share your contact information? According to Miriam Aristide, she's asking if you can share your information so we can connect to the community to these resources. I want Stephanie you to talk about.
Do you want me to put it
Stephanie-
in the chat? Do you want me to put my information in the chat?
Afterwards, you can put it in the chat,
Okay.
but I wanted you to talk about how your organization, does everyone come to you, or are you also on the street, talking to people, going to churches? In a way, mental illness to some is, a phrase that they may not want to hear, but I'm wondering if people come up and say, well, I've been feeling depressed and I need somebody to talk to. They may not want to use the terminology, even though we know that it is a form of mental illness. There are people who are just regular, everyday people, but who have something going on that they may feel that they can't share, but it will drive them to suicide.
Yeah, yes.
So how do you approach it? How do you find people?
Well, we do a lot of outreach. We have 10 partnerships. We do a lot of outreach with the 2-6, with the 3-0, with the 2-8, the 3-2, the PSA 5, and PSA 6. That's just some of them. But we are out in the streets with resources, and we created this when the pandemic hit. All of everybody was shut in. So what we did was created this Love on the Block. So we have a series of that started in June to October, and we go to different neighborhoods in Harlem where we close the streets down, flood the community with resources and food, and we have bouncy house and music, and it's just everything you could imagine. So we're very visible, we're out there. And because I'm a survivor of domestic violence, so it was important to me 15 years to come back to Harlem, because I didn't see anyone that like looked like me. It was no representation, and it was still like a stigma. It was still like, you know, a shame, you know, don't talk about this, you know, we don't talk about domestic violence, we don't talk about mental illness. So it was important for me to come back so, you know, women of color can see another woman of color speaking about these issues that people are still ashamed of, still stigmatized, still hush hush and look down on these issues. That is going to keep our community and our people crippled. So we have to expose it for what it is. It is a crime, not a shame, to be in an abusive relationship. And mental illness, it's a mental illness. It's not something that you need to be stigmatized or you don't have to talk about it, because that's how we get the help. We can't fix what we can't see. So we have to start identifying what these services are and bringing them to the people. We stay open through the whole pandemic. We are a physical space. We are open to the public.
Where are you located?
Where are you
located?
We're at 8 West 126th Street, right off of Fifth Avenue, between Lenox and Fifth, but closer to Fifth Avenue. And I'll put all of our information in the chat. We've been operating
How
now.
large is staff? Oh, I'm sorry. How large a staff do you have, Stephanie?
Well, right now I have a staff of 4, but I'm in the process of hiring 4 more navigators, 2 social workers, 2 outreach coordinators, and 2 drivers. So we just received a multi-million-dollar grant from the mayor's office. So we are now in the process of expanding. So that's what we have been doing since January. We're in our expansion stage because the numbers, the caseloads, and we're in the crisis right now, and they recognize that. You know, they're starting to recognize it. And so we did receive the money to expand because we are overworked, and it's a lot of women and a few men in our community that's suffering from domestic violence. And there's no other service that's visible. I mean, I think Safe Horizon is around, but they're not in the community. We're grassroots, we're boots on the ground, and we're from Harlem, we're from the project. So we know how much a gallon of milk costs in the bodega, because this is our community.
How long have you been around? How many years?
12 years now.
Okay.
Yes, 12 years.
All right. There's some other questions. Let's see what's in the chat.
I'd like to say something.
Marita.
Yeah, I'd like to say something because I know you didn't mean it the way it came out, but first and foremost, let's not try to close the bodegas, because there are many, many, many families financially that need those bodegas so they could get something until they get the check and get the milk or whatever. So let's be kind of easy on that. The other thing that I'm more concerned about is that when the phone call came in for the police, it was noted that the person had a mental problem. The police should never have gone there without the trained personnel for that particular thing, because they walked in and of course the guy shot him. Maybe if they'd have had trained personnel with them to go, and it might have worked differently. But I think those 2 officers should have had a little more protection. That's my
mean, Laquita, that goes back to us making sure that Be Heard crew is out there working, because right now it's not.
Yes.
Yeah, I'm just being honest. And I circulated that article that was written about the guy on the train. Apparently he had told one of the psychologists that it was just a matter of time before he pushed somebody on the train, and yet he was allowed to be released. So, you know, that is, I think, mental illness. And then somebody sent me a video of a guy who jumped in front of the train and jammed his body up in the middle of the train while I was on the tracks. I'm gonna see if I can find it and I'll send it to you.
And that's Monica. Monica, that article you sent from the New York Times, that's in the last email that I sent with the agenda, and I thank you for that.
Right.
And the whole dealing with, I forget the title, but it's in, everyone can check their email, all of the
Right.
committee members. I'll try to, or Monica, if you could put that link in the chat, that would be good. The article you sent.
I may not be able to do that because I'm on my cell phone because my laptop isn't working.
Oh,
You
okay.
know, we
Okay.
have to deal with it. I mean,
Yeah.
you know, they've been killing mentally ill people since Eleanor Bumpers, which was what, 82?
Yeah, around
They
there.
have spent an inordinate amount of time, money on training, and they're still killing mentally ill people. We just had one up in the Bronx. It didn't make the media because, you know, he's a Black man, but a long-term person, noted mental illness. They told them that when they called. So, you know, we have to, I don't know how the community mobilizes, but, you know, at some point in time, we have to deal with the mental illness and nobody wants to deal with it.
Yeah.
Yeah, that's an
Well,
issue.
that's
You know,
why
we
it's on the agenda.
Yeah, we
You know,
keep putting a Band-Aid on the Grand
Right.
Canyon and not really dealing with it. And that officer, I have to look at that. I mean, I can find out all the information. I didn't hear that. I was at the hospital that the call came out that the kid was mentally ill. I didn't hear that, but I will look into that. And
No, he was
Oh, no, his mother said he was mentally ill. The mother said that make a call. She said he was mentally ill.
Okay.
They do.
Well, hopefully there'll be some training and something come out of this where it can be avoided. And this is a sad situation for all three mothers.
That's right.
Comment. One of our last meetings, maybe not the one in January, but maybe December, and I think Monica was alluding to that. We had someone come and speak, and I'm trying to remember which agency it was.
Yes, the male doctor, Dr. Jackson, there was a man.
No, it was a woman who was coming.
She was from the Be Heard program.
I see.
From the Be Heard program.
Thank you, Monica, because I couldn't remember the program, and the way that program was designed, it was supposed to be a comprehensive team approach where they had someone who would be available to deal with a crisis issue so that a cop wouldn't have to come out and deal with such a thing because that's not in their warehouse, but someone who was an expert. And it sounds like that was from what she said, and I was trying to find it, it was like a pilot and they were trying to get it up and running.
Yeah, but it's in the 2-6 precinct, but you got to remember, the problem that they have is this. The person that decides who shows up is the dispatcher. And I'm sorry, you know, I'm sure that the dispatchers are lovely people, but they should not be making that determination.
Right.
Right? Because, you know, I'll give you, for instance, in my building, when the 8 cop cars showed up, and 16 cops for a young lady who was having a mental break, and her mama told them that. And the cops were really nervous. One had his hands on his gun.
Yeah, because they're not trained to deal with that. The police officers are not trained to deal with that mental illness.
Of course not. And you know what? It's a dangerous situation. It's more dangerous for the community than it is for them. Luckily, my neighbor was able to talk her into the ambulance, but you know, that could have gone wrong.
Right.
That could have gone very wrong. And so we still have it. We've been talking about it since Eleanor Bumpers, and we still have the same issues. And it keeps happening.
Yeah.
Right.
Well, I put an article in the chat. Toronto just started one that's going to be in March. Toronto Police Department. They're going to put mental health as part of their outreach, so they won't be going. There's a dedicated.
Yeah, but we don't have to go to Toronto. Austin, Texas. When you call the cops in Austin, Texas, they say fire, ambulance, police, or mental health? That's what they ask
And
you.
then,
And then,
Yeah,
and is there an
And then
armed,
what do they say?
Monica,
They
in
said-
Texas,
this is
is there an
the-
armed officer? Oh, I'm sorry, I
no,
spoke over
no,
someone.
no, nobody armed goes out. They have mental health professionals who go
There you
out
go.
to the team on these calls. Like last year, they went out on 3,500 calls and they had no incidents. And you know, like the police chief said, those are calls that cops don't have to go out to. In Baltimore, my girlfriend works for the mayor. I asked her for the plan. She hasn't sent it to me yet. A quarter of their calls were mental health or wellness checks to 911. A quarter. They will no longer be sending police out to those calls. They are working with Johns Hopkins University and Johns Hopkins University Medical School to come up with a comprehensive plan to deal with these issues. But New York
But
City
what,
is
how, I wonder how they, I'm sorry, go on. The sound quality is not that good, so it's hard to know when.
Yeah.
I'm
So,
sorry, go on.
you know, we're not dealing with it in a comprehensive manner. We're dealing with it as a political issue, as
Yeah.
opposed to looking at it holistically as a health issue. And you know, the mayor, he's a young one with a big afro. He has specifically gone to professionals to say, how can we stem this? And they've done all the research on it. They've done all the research. So,
Where
you
is
know,
this again?
Baltimore.
Where's in Baltimore? How can we, do you know to what extent the people in New York know about that? I mean, is there
I don't know.
anyone?
Listen, I don't know if anybody knows about it. It was in a New York Times article. That's how I found out about it. I have a girlfriend that works for the mayor, and I asked her to see if they would be willing to send the plan that they have to us. You know, to see if you know, this would be something awesome for Columbia University and Columbia University Medical School to do.
Now that sounds like something we could
Yeah,
write
I
up
mean,
with a
again,
PBA for sure.
Yeah, and again, you know, excuse me if you misunderstood what I said, the person that responded to my comment about the bodegas. You know, if you look in our community, if you look around and you see all the liquor stores and you see all the bodegas, where are the resources for our people? That's what I'm talking about. You know, pain pays. So at the end of the day, do you really want this resolved, or do you just really want to put a Band-Aid on the Grand Canyon? Because if you really want to start getting help into these communities, like 155th Street up there by the Polo Grounds, right across the street from Manhattanville, or over there right across the street from St. Nicholas Housing. These are communities where there is a lot of mental illness. There was a little kid, Aiden Wolf. We did a whole big rally for this kid. He was the youngest kid that I've ever had to attend a funeral. He was murdered. He was beaten to death with domestic violence. And then he was sexually assaulted by the mother's boyfriend. That's mental illness. But people in our community, they heard the cry. And when the officers went to the building, now we're not saying, you know, the woman didn't pick up the phone, but the officers didn't do their due diligence to knock on every door to see where this cry was coming from. So we're just too comfortable with this suffering and what happens in our community. We're just too comfortable with seeing a bodega on every single corner. You gotta have a bodega on every single corner.
I don't think people are comfortable. I think sometimes we just don't know. It can be sudden, something that someone doesn't see. There are family members that might see what's happening to their family member. They don't know where to go for help, or they might go, but it's too late, or they call the police when it's in action, when the action is taking place. There are a lot of factors. I don't think the community is
early intervention. If we have more early intervention.
Right, but are you talking about the little boy where the mother and were that they were interviewed by everybody, NYPD, the DA's office, and everybody failed to do anything about it? Is that the one you
No,
talking
no, I'm talking
about?
about Aiden Wolf. He lived in St. Nicholas housing. And
Um,
a neighbor and on the floor heard a little boy moaning and groaning and screaming and hollering, and called the police and said what they heard. The police went to the building, went to the floor, but when they got there, they called the woman's number back that called 911. She didn't answer the phone. The police didn't go knock on every door on the fourth floor because the little kid lived on the fourth floor. And then the next night, the mother called because the kid was non-responsive. So
right.
he had beaten a little boy to death, but there was no early intervention. It was happening and no one said anything. And the mother was dealing with her own issues. I didn't get an opportunity to talk with her, but I did talk with the father of the child. And she was dealing with her own issues. But this is not the only, situation. There's been several murders that we've dealt with in our community, domestic violence, but there's just not enough resources. And that's what I'm saying tonight to you all. There's not enough resources out here to deal with the mental illness and the domestic violence. There just isn't. Safe Horizons is not in our community. They are around, but they're not in our community. There's no satellite programs in our community where we can go get help. That's why we opened up and that's why we stayed open. So during the pandemic, we created a respite for women just to get out of the house, to come with their kids. And they didn't want to make the decision to leave today. Well, when they came back the next day, they was like, okay, I think I'm ready to go. But we had a place for them to come. So that's why we're starting this pilot program with an open clinic for anybody that want to come. Because we understand the importance of having the resources, because we're dealing with a lack of resources in our community. And that's why we have our events and some of the public housing like St. Nicholas and Drew Hamilton and the Polo Grounds, and we'll be coming over to Manhattanville. One that we're working with Chicken Murphy to bring our Love on the Block to that community as well, because we know that there's a lot of deserts in these communities and there's just not enough services. So we're here because these are our people. It's our community. And we're here to let them know that the services is available.
Can I make a comment?
Oh,
We
yes.
also, when we talk about services, let's go back and this is not what I call the vacuum of what's happening now. Back in the 80s, okay, when they cut all the services from mental health out and closed some of them. This, if you think about it, what about all the men that came back from Vietnam, the 60s, 80s we went to war, 2000 we went to war. What about all of that population too? So a myriad of not having services cut in the 80s and subsequent wars that men have been coming back home, men and women coming back home. Okay, it's bound to happen, but this is not new. They cut their services for mental health in the 80s.
Yeah,
Yes,
but
they did.
I want people to understand, nobody cares. And the only way that we're going to change it is by going to see all the politicians to say mental illness should be the number one thing. Look, I have clients who are severely mentally ill. Many of them have been in and out of the hospital since they were 8 years old.
Yeah.
8 years old. And guess what? Nobody wants supportive housing next to them. Nobody really wants a mental health clinic in their neighborhood.
Right.
Nobody wants to deal with substance abuse issues, really. Right. And so here we are. And I mean, it really is a crisis. I was on the and they had taken a subway car, and these are clearly mentally ill people. That's all. That's all they are. And there was one incident at 42nd Street, and the cop made the guy go upstairs like that's helpful. Hospitals don't want to keep them. And you know, until they hit some Asian woman upside the head and kill her, then you know nobody's talking about it. But you know, we need to get to the point where nobody gets hurt.
Yes, absolutely. And I want to just piggyback on what the brother said about the wars. You know, there's another factor that we kind of took out this equation that really crippled the Black and brown community. And that was the flood of the heroin in the 60s. And then when the 80s hit and that crack cocaine, we're still, I went to visit my brother up in the penitentiary, and I just came out of there. I was so devastated. This is about 5 years ago. I was so devastated because, you know, I was up there and we was in the visiting room, and I was like, God, look at all these young kids up here. And he's like, you know, he said, Stephanie, these are the crack babies, the grands of the crack babies. Cause the way he said it was like, they fight over Little Debbie, they fight over like every little thing. And it just hit me like, oh my God, because when they flooded our community with crack, it devastated us. And we have all of those kids going into foster care and going to systems. This is where those guns, you know, when you don't have compassion, when you don't feel good about yourself, when you don't appreciate yourself, and when you don't value life, you're not going to value anybody else's life. So I'm happy that they're giving money to the cure violence groups, but there's so many other issues that could be dealt with, and that money could be going to besides cure violence, because the violence is happening and you're just responding to the violence. We need to get in there, and how do we dismantle it? By putting more money into mental illness programs and some of these households that need, again, I'm gonna keep talking about the services that these women need places to go, because they're stuck in the same kind of trauma that their kids are stuck in. But those issues were never dealt with. So now we got, like, you know, this explosion.
Ms. McGraw, I mean, this has been fascinating, and it's going to continue, because I want to hear what Reggie James, he's been waiting too. His organization is Brothers in Recovery. Now he's going to tell us about Brothers in Recovery, and there'll be discussion. And if you hang around, there might be some questions where there's some continuity here. So just let's hear from Reggie, and
thank you.
And let's
so
keep
much.
in mind that we probably should try to wrap up at 8:30. But
Thank you
there's
so
many good. We're going to continue this, and that's why I think there's going to be something like a series of discussion on it, because we got to find some way to do something more. And anyway, so let me not talk anymore, and let's hear from Reggie and see what he says.
Thank you so much. Thank you.
You're very welcome, but stick around though.
And
Good evening.
I know Reggie very well.
My name is, as Laquita said, my name is Reggie James. I'm the chair of Brothers in Recovery. I'm a person in long-term recovery. We thank you for having us and hearing what we're about. We've been around for since 1988. We're a spiritual organization. We started as a retreat. We started from a 3-day retreat where brothers, mostly Black and Latino brothers from Harlem, and most of them were in 12-step programs, and they went up to this retreat and from Friday to Sunday, and talked about men's matters. Men have this persona of being type A personalities, don't talk about things like substance use disorder or mental health issues or the feelings that they go through that bring them to a certain point. And it evolved over those years to, get involved with community, teaching them about, different health issues around mental health.
I don't know what to say.
Oh, somebody mute themselves. Okay.
Mute.
Yeah,
Okay.
that not only that she's 60, but we don't have that.
Monica, we hear you.
I'm sorry.
Mute for a second. Okay, go on, Reggie.
So, and about 15 years ago, we became a
Hold on.
501c3, and we are, and more recently, 2 years ago, I became the chairman to evolve the spiritual organization into having a business outlook, kind of to develop a workforce of certified peers. You know, from SAMHSA, the federal agency, they have recognized that clinical with experiential is the effective way to deal with mental health and substance use disorder. As you know, substance use disorder comes under the auspices of mental health. I don't hide the fact that I'm in long-term recovery. When I let people know that, they say, really? Because I've had a number of professional positions. I'm an entrepreneur. Many years ago, I produced the first map of Harlem in 1986, 87. You know, I was former vice president of marketing for what's now Affinity Health Plan. It was the Bronx Health Plan. And I've had a long journey hiding and dealing with my substance use disorder. Not everybody is stereotypical. Some people can be productive. So I've had a long journey. Now I'm a recovery warrior. And what we talk about is destigmatizing mental health as well as substance use disorder. And it starts with the language. You know, we don't talk about people as addicts or dope fiends or crackheads or crazies or, you know, loonies. That we don't use that stigmatizing language. It's person-centered. You know, I'm a person that has had a substance use disorder issue. I was listening to both Mr. Torres as well as talk about the intersectionality as well as Mr. Edwards in terms of self-medicating with the cannabis. We address all of these things, okay? So a lot of people, a lot of our members have come from 12-step background or the faith background, but there are multiple pathways to recovery. So our organization, we're aging, okay? As you can look at me, tell I'm not a young boy, okay? I've been around a long time. So to have sustainability and succession planning, we have to be open to other modalities. Most importantly is harm reduction, okay? Because a lot of people in recovery, they're like, you know, it has to be abstinence. No, it does not have to be abstinence. You know, I was in harm reduction many years. I stopped using heroin, okay? When I started working for the Bronx Health Plan, I had gone into a rehab, but I was drinking and smoking. I was smoking herb and drinking alcohol. I was productive. I was a national speaker. You know, I had controlled millions of dollars. I had a large staff. Eventually, I had to go towards abstinence, but it took me a long time. And in 12-step programs, they would kind of look down on you because, you know, but it's not all of one. You know, some people are in moderation recovery, some people are in medication recovery, some people are in abstinence. You can do it through the church, you could do it through Wellbriety. They have something called Smart Recovery. They have all kind of different things. So in Recovery Coach Academy, what the grant was for, you know, was to have more people understand these modalities and to treat people as a resource rather than as an object or an object or a recipient. So some of the things we're addressing, you know, right in Harlem, you know, is this oversaturation of these treatment centers in Harlem, right? And, you know, the vending machines and the safe consumption sites, you know, these are very tough subjects to talk about. How, you know, we do not want to come out of a train station and have people nodding all over you and, you know, the businesses, how it's affecting the homeowners and the businesses and people that just live there. So, you know, hopefully we're part of the solution as we develop this workforce. And what this has helped us to do is to bring some women into our circle. So the lady that was here earlier when Mr. Torres Mr. Edwards was speaking, but that, Marinez, she was part of our class. She took the Recovery Coach Academy class, which is a 30-hour class, and she took the ethics class, which was a 16-hour class. Then they'll take some medication assisted treatment, what we call MAT, and some electives, and you'll have enough hours, then you're certified. You can't just throw people out in the street and say, help these other people unless they, know what they're doing. They have to have a background and lived experience of different things. For me, I was directly affected by substances. Someone like Marinez, her father, had, this issue, and she lived with it. I don't know too many people that don't know someone that's been heavily affected by substance use disorder or mental health issues. And we just have to talk about it. In my family, I'm the elder of the family since my mom died, and I just talk about it because we have all type of Ivy Leaguers in our family. They're very arrogant, they're very smart, and they, and they can hide, they hide. And, like I did, most of my life, because I work out all the time and I know how to make money. So, there are people like that, and there are people that go all the way down. So I talk about it freely, and it's things that we have to continue talking about. That's right, because cannabis is going to be legalized. I have mixed feelings about it. Was it a gateway drug for me? Probably, because I have an addictive and compulsive personality. Do I feel it should be here? Yes, because too many people have been busted, and in our over police communities, and have a record, for smoking herb, or selling $5 bags. Come on, that doesn't happen in other communities, and all the data points to that. So that's why we're here, and that's what we're doing right now. We just received. We're going to get technical assistance from the opioid response network, and that's some of the money that the pharmaceutical companies that have been, that put out all these opioids and what have you, some of the money they were sued for, is being directed to some peer organizations. And so we're going to get some help with strategic planning, with sustainability, and with succession planning, because I'm very concerned about our organization having the legs to continue on. And if we don't attract some younger people, and if we're not open to other modalities, then an organization like us is going to die off. And we have been around, like I said, 34 years. We have support group meetings. We have one on Tuesday, one on Wednesday, one on Thursday. We have a whole Southern region. So we're a national organization. And, just now, because, I personally, being a social entrepreneur, I'm sick of people that don't look like me getting all the money and they throw the pennies in our community, and they're on top, and they're all these snow cone companies where we're not controlling the dollars in our community. So I've had to be very strong about this to our organization, because most of them, they're guys that work, I'm a guy, because of my record, I gotta find my way to do things, because I like a certain lifestyle of living. So, I have to always find ways to think outside the box to make a living, and for us as an organization to move forward and not just be recipients. And basically, since we don't have a lot of time, I'd like to answer some questions, and then I can fit in some other things as we move forward.
Reggie, so your organization has been around for 34 years, and probably, if I remember correctly, the last several years is where you really found that you could begin to get some real funding.
Yeah,
for what
we
you're
haven't,
doing.
we haven't gotten much of any funding. We really survive on dues, and we've gotten very little funding. And
how many, at least I was just going to ask, how many other men or men and women come through your program, or where you're talking, or in a way I kind of pictured like Alcoholics Anonymous, So
Right.
this Brothers in Recovery is kind of like that, but dealing with those who've had substance abuse issues and
Well,
other.
I'm gonna I'll put my information in the chat, but if you go to birusa.org, you'll see a picture of, the brothers at one of the retreats. So it's about 100 and something. We have maybe several hundred brothers across the country. And at one time, you're right, it was kind of like a 12-step type thinking. I'm trying to get them away from that, okay? Because, when I became chair, I said all board members have to take at least the Recovery Coach Academy, because if you don't, then you're stuck in old thinking. And 12-step is almost like I don't want to be derogatory because that was helpful for me. That's how I, managed to get to where I am. But it's your that way or the highway, okay? And there's no in between, and that just doesn't work. It doesn't work for young people. It doesn't work for this environment we're in. And there is such a thing for harm reduction that we have to address, and that is real. And the new commissioner of OASIS is having a whole harm reduction component put there, because 5 years ago, you didn't even hear about this. So now that has transitioned. Recovery has changed, just like the language has changed and the attitude toward it changes. The way that we look at recovery changes. As I said, when I meet people and I go to a lot of different affairs, I let them know right away, I'm in long-term recovery. I'm a social entrepreneur. This is what I do. Now, we're a complete volunteer organization, but I have private recovery businesses. So the thing is that, as I said, there are multiple pathways. There are all type of different thinking that, goes into this. And we want to show that these were the people then, and they transition into productive citizens now. And you don't have to hide, okay? We have to stop stigmatizing this.
There may be some other questions, but I'm wondering, do you, you mentioned harm reduction. There was a company, I don't know if it was the one, they have a Medgar Evers College component, and there's a psychiatrist, I somehow believe his name was Dr. Jackson. I was actually looking for it. And I was looking for it, but who spoke to the committee and spoke to the board and spoke to the board. And they talked about harm reduction. So that's, I know some people, maybe me even at times, though I worked with the mental health organization, can feel a little queasy about it, but these are people who had a drug issue. They're given a space where they can come, and instead of just on their own putting together whatever the potion or concoction is, they do it right in front of someone else. And if I'm explaining that correctly with harm reduction.
That's part of it, Laquita, that, there's so many different components to harm reduction. Harm reduction could be like, if I drink a pint of vodka, when I come home in the evening, and I take that down to a half a pint of vodka, and I say I'm in recovery, guess what? I'm in recovery. Because who's to tell me I'm not in recovery when I'm trying? Yes, I saw somebody put overdose prevention services. It is kind of the support of people, that want to go in that direction. And we understand everyone doesn't get there. We have to meet people, as I heard earlier, where they are. And that's what this is, meeting people where they are, not to demonize and stigmatize, whether it's a recovery situation or us as people. So the more that all of us, and the grant is for people in Community Board 9. So anybody that you have, and I'm not sure if you have the flyer, if you want to put it up, if you want to make me a co-host, I could throw a flyer. Like our next class starts on the 19th, on February 19th, and it's 30 hours.
Hey, Joan, I don't know if I have it. I'm not sure if Edwin, are you still?
I made him a
Can you-
co-host.
Oh, Solomon,
Oh,
did
you
you
did?
get flyer?
Okay.
How can you email it? Because I think Solomon has been putting us some information. I've been checking the chat as often as possible because there are a lot of people, responding, many applauding what you're saying, Reggie. But Solomon, go ahead. Can you? Oh, this is Reggie putting it up.
Yeah, I'm gonna try to find it. Yeah.
Okay. Let me see what other comments are in the chat.
So this is the, can you see it?
Yes.
Okay, so this is our next class, which is going to be online. Normally the classes are in person, but because of COVID, obviously everything is online. And we break people up into rooms and what have you. So we make it fun. And my co-trainer is totally different than me, different ethnicity, different lifestyle, very conservative. I'm much more, even though I have this button-down shirt on, I'm not usually conservative. This is as conservative as I get. But we make it fun and we deal with difficult issues. We deal with, white privilege. We deal with, sexuality, a lot of other trainers. I'm a best practice trainer. I'm fortunate to be one of the 30 best practice trainers in New York State. Only brother that has that distinction. And we make it fun because I love to train. I love to teach, to talk about this and to talk about my own journey and to hear other people's journey and to find out what they think their solution is, what's next for them. And then we kind of just direct them. We do a lot of listening. We ask good questions and we handle our own stuff, meaning our own prejudice and our own biases. So we make it exciting. So trust me, this was life-changing for me. If somebody was interested in taking it, it would be life-changing for them. And if they're in your community board, they can take it for free because the class really costs $800.
We should have this for distribution. Our board is going to meet, but in our packet, that gets sent out prior to the board, this may be something that we could insert in there.
Okay, fantastic.
In addition, as I had mentioned and I really did mention this to Stephanie also, if there's a particular issue or other that you're seeking that's going to make for some, what you think significant change and how rules and regulations, institutions, whatever they're dealing with that require or could use a letter of support or resolution. Definitely if you're going after a grant, if it's something that we can hear about and come to agreement on, we could also give a letter of support because that's one of the things that the community board is charged with, supporting its institutions. So it is organizations and groups. So send that flyer, email that flyer to me. And meanwhile, think about that. Keep coming back to talk to us. Like I said, we're going to have a series of discussions related to mental health because we have to make a contribution toward doing something. It's a massive critical crisis problem. As Stephanie also pointed out, we got to begin to do something because it keeps coming up. It's not like we're trying to push it under the rug, but even if we were, we couldn't. It just keeps coming up. Are there other questions and statements? There are a number of statements that were in the chat, and hopefully you'll get a chance to. Juan said, Reagan stopped services for homeless and veterans. Bad decisions have brought us here. Okay.
We're in a really serious, given what's going on with COVID, exacerbating everything, there's really no turning back. And we really have to try to put something in place to tap down and attack this particular issue because it's not going anywhere. It's only going to get probably worse. So,
and I was trying when I talked to Stephanie who spoke earlier, I was trying to think of this before I knew that Reggie was going to be coming to speak. And I said, we got to do a series and try to deal with some issues. It's hard to deal with every aspect of mental health at one time, but if we take one thing that happens, maybe we can begin to reach out to other institutions that are working with those. We have a number of organizations, agencies in our community. They're doing good work for the most part. We need to hear more from them. I don't know what kind of load they can handle, because many of them are, depending on the size of their grant, can only help a certain number of people. And meanwhile, the next thing you know, something tragic happens, and it's like, wait a minute, was that person in a hospital? Were they being helped? What happened? Or how did we miss that one? Or where was the family? There's got to be something we can do. And what might help us is maybe just encouraging friends and family to say, look, if you see your friend or your relative in need, if something seems strange, let's see if we can find a way to talk to them. How do you approach them? Because you don't want them to be, to become angry about what, they could react in a very strong way and push you away. How do you do that? What do you do after that?
Does anyone know how long?
Edwin?
Does anyone know how long it takes to get a patient to see psychiatry? That is not an emergency, that tells you I'm depressed, I'm anxious.
Here's the reality. It's Monica. Excuse me, Edwin. All of my clients are on waiting lists. Everything is a waiting list for mental health treatment.
You're right.
Takes 6 months.
When your client goes to the hospital, he can be mentally ill, severely mentally ill. They release them immediately. That's the same thing that happened to the guy that pushed the Asian woman onto the subway. I had a client, literally, the shelter, he was in a mental health shelter. They called, and 2 seconds after they called, they released him. So they're not doing a 72-hour hold. They're not using the mental health law to try to commit them. They're not doing anything.
Right.
And our clients take months and months and months to get an appointment. And what the programs tell them is, if you're in that bad of shape, just go to the emergency room. That's unacceptable.
Yeah, you're right. I mean, somebody wrote in the chat before about the lack of health insurance that makes it even more or less accessible, which is unfortunate.
But not really. I mean, you can have lots of money, and it still takes you a long time.
Is it because there's not enough staff?
There's not enough staff. There's not enough staff. One of the problems that people don't realize is that during this pandemic, people that were in FACT teams, ACT teams, any kind of oversight, the visiting nurse service deals with a lot of extremely mentally ill people. They were doing like Zoom meetings. Okay, that doesn't work for them.
Yeah.
They stopped taking their medication. They became homeless. They show up every now and again. The substance abuse problems were off the hook because these programs shut down.
Yeah, you're right.
Oasis decreased the capacity of every drug program in the state.
So maybe what we can do is some kind of resolution, in terms of more funding. The police supposedly, has all this additional funding that's supposed to help, not necessarily to increase the police, well, at least supposedly, but that's more directed toward care or services that are needed. Maybe we need to put our weight behind that kind of support and say, demand.
Right.
We should have our electeds coming over here. because our hospitals, they also have a responsibility to the health of the community. When folks show up to the ER on distress, they should have a plan, a tangible plan of who they're going to follow up within the next 48 hours. So these conversations that we're having, our electeds, they should be here with us, not only at the general meeting where they hear everything, but here where we have the different stakeholders in the community speaking about the issues that we see that are happening.
That's a great idea. Maybe that could be part 2. Let's see if we can get who, the committees have been assigned, and I forget, there's a lady, Councilwoman Schulman is in charge as chair of health. I don't know if there's a mental health subcomponent. Did Sean Abreu say that he was City Councilman Sean Abreu?
We should bring him because he still has a responsibility to the constituent that live here.
Yes, he does. But I also think there's something related to health that he's involved with too. So yes, let's reach out to Sean, and maybe he can help us get Lynn Strowman as well. We were lucky last year, up until last year, that Council Member Mark Levine was chair of the Health Committee right in our district. But let's try to do that. So I think in answer to your question, Edwin, how long does it take for mental health, a person with issues, to get help? What did you say it was, 60 days?
6 months.
Oh, goodness.
Well, that's why they tell people, Laquita, that's why they tell people to go to the emergency room. Okay, but what happens in the emergency room?
They're just waiting and waiting and spending the night and waiting and waiting.
No, not even. They look at them, then they release them.
And there's a tale of 2 cities: those who have private insurance, those who have Medicaid, those who have Medicare, and those who are uninsured. And at the end of the day, we're still going to have to, address the mental health issue that folks have, because folks are going to continue to be in the streets.
Correct. Right.
It's going
They're going to be homeless, which is where a lot of them are now. Literally.
Yeah.
Because here's the other thing, Laquita, and nobody's talking about this. My neighbor works for the MTA. They are finding record number of dead people at the end of the line and in the yards.
And where? End of the line where?
The end of the line on the trains.
Oh,
and
my
in the
goodness.
yards. Oh, we're not talking about that, Laquita. We're not talking about that.
And what are they attributing it to? Homelessness in general, or suicide?
They say homelessness in general. Homelessness in general, but they think that a lot of them are ODing. But they've never had this kind of a problem before.
Oh, really?
So record numbers, and Laquita, they're taking over whole train cars.
Oh, really?
I know the stuff. Now, see, it's interesting because the way it was presented at, was it the meeting with the DA, the district DA, the new DA? I can't recall, but there was, the way I heard they presented it was, there's an issue with crime and the subway. So when you say the subway, I'm thinking, okay, there's crime in the subway, but this is something else that is the subway. You can't ride it. I know some friends of mine are saying they're not getting on subways anymore, or after a certain time, or only in a certain location.
Yeah, but all the homeless aren't bothered. I mean, like when they take over a car, they're all sleeping. Right?
Yeah.
I mean, when I get into the car that they've taken over, they are stretched out on all the seats. They're not trying to hurt me. They're not trying to do any kind of physical harm to me. But you see them and they're mentally ill.
Mm-hmm. They got some problem.
I mean, we see them walking with no shoes on.
Yeah.
Talking to themselves. I'm gonna see if I can find the video of the guy that jumped onto the tracks. Somebody sent it to me and I'm trying to
And we
see.
got, there was a way that they were getting help, you know, someone going up to them, police going up, you know,
Not
we'll
the
call
police.
someplace and
We
find
don't-
shelter for
We
you.
don't need the police. There needs to be an underground mental health brigade. Just like they put all them cops on the platforms, they need to have mental health people who do nothing but ride the train and go in the stations and gather them up and take them. Now, when it's cold
if I
blue-
could say something, you know, you're totally right. There has to be a multi-prong approach to it. You know, some of my talks are with the Greater Harlem Coalition, and their members feel like they have extreme differences. Some people would like to line them up and shoot them. Other people like to invite them over for dinner. You know, there's a lot of different feelings about what should happen, and there's no one solution. It takes a lot of empathy and direct services and treating people like human beings. And hopefully when they're ready, because you can't do anything unless a person's ready. And even though I deal with the substance use disorder population, most of the people have mental health issues.
Know that. I know exact. That population is a lot of my clientele. I know exactly that. Not until they're ready, but we have to have people that work with them every day to get them to the point where they move from the subway to a place where they can have a decent life. Because right now, what I see cops doing is telling them to go upstairs. That's not helpful. And then when they beat some Asian woman upside the head and kill her, you know, they are racist, and they need to go to jail forever. So, you know, we have to deal with the realities of what we're seeing. And I mean, everybody sees it. And I have to be honest with you, it's not the cops' job to deal with severely mentally ill people. They are not equipped.
You're right. They're not.
That's true. No, I'm saying
These are the symptoms of a sick healthcare system.
Yeah,
absolutely.
Yeah.
I was just saying what they
people want to exactly.
Why?
People want to use the cops to deal with it, and it's not a issue. That's why they coming after Alvin Bragg. That's not a issue.
You're right.
Because somebody's sitting in has taken over a subway car. I mean, it was really sad, and there were 1, 2, 3, 4, 5. There were 6 people on the subway car, and there was so much garbage you couldn't even walk.
That's sad.
And then I found out that when it's cold blue, the street outreach doesn't work.
Why?
Right? What they will do is they will send the cops out to this homeless person to take them to a shelter. How is that a cop's job?
That's what I was pointing to, that they used to do. That was at least that, you know.
Well, they still do it. I called on the homeless lady that sits in front of the New York Sports Club. She sits between the New York Sports Club and the Bank of America.
Yep,
she is out there 24/7.
Yeah.
And freezing.
And they said the only thing that I said, I wanted the street outreach team to go because I've had clients that they built rapport and were able to get them in the shelters. They're very good.
And this whole thing with mental health, we have a better understanding of the chemical imbalance that indeed it takes place. You know, it's not something fictitious. It's just like when you take your blood pressure and it's high, you see the number. That is exactly what happens in the brain. Some folks, they suffer from schizophrenia, they suffer from depression, they suffer from anxiety. These are chemical imbalances that are taking place in the brain. And you can measure them. We have the scan for that. You know, a lot of times we need to be careful with our language, because when we overemphasize calmness, that is sort of, you know,
it can be a trigger.
Negating the reality of what's happening. And those folks, they can feel, you know, stigmatized, because they're like, well, Am I not doing enough yoga? Am I not doing enough
Yeah.
meditation? Tell somebody to have high blood pressure. Bring that blood pressure down by meditating. It's not going to happen. You're going to have to
Right.
take a blood pressure medication to control it. So we understand health, mental health. The only thing is that folks need to have access, and they need to have continue follow up with those providers.
Yeah, that's
And
important.
they need
Continuous follow-up.
supporters. I think it's really is something that family and friends have to be able to come in and support too, because there's so much other,
No, no,
nasty.
absolutely. But people have to understand these people who have mentally ill children they are done. I call my clients family.
It's a lot of the stressors that Edwin was talking about.
They've been dealing with his insanity since he was 8 years old. And now he's 32. And they'll tell you, Ms. Dula, I can't do it anymore. We have done everything. We tried to get him civilly committed. We took him back in. He set the house on fire. I mean, just like crazy stuff. Just crazy.
But it's
But
got
let me
this.
just say this. Let me just say this. The New York City police budget is $10.9 billion.
Mhm.
It got a $315 million increase last year. Take a look at what the mental health budget is and look at their not so
Well,
increase.
that's where I
No,
was headed in terms of
Right.
putting something forward, forcing something on that, which means we'd have to do it rather quickly. Not that they're going to work on I'm not sure how fast we're going to get to the
Let's get
budget.
these
but
legislators into our committee. Let's get, not
let's
only
get
the
right.
city
Let's get the
council, let's get our
the city.
states, our state, stakeholder to come in and sit here and listen to the people.
Yeah.
Right. And then we're going to need Reggie, Stephanie, I'm not sure, hopefully Stephanie's still there. Some of you to, definitely be here with us when we have the discussion. And I know there's some others that I could invite to make sure I'm here too, so that it's a real meaningful discussion. We need to really
Yes.
Yeah.
have maybe some
I'm
questions
open to attend your
beforehand,
meetings
so-
around this subject, and I do know Stephanie's a colleague. I've known Stephanie for years.
Okay.
Sorry, this is Indiana. My tip is we should schedule multiple meetings. Like, we have it now before they get started really on the budget discussions, but give it 3 weeks and then let's check in with them again. And then, 3 more weeks and check in with them again, because they're going to take a million one-time meetings. But if we can schedule at least 2 meetings, that way we can check in with them before the budget's done.
Indiana, are you suggesting if 2 council members come to one meeting, or one, and then the next month another one comes?
Or it can be like the same members, but we meet with them initially, and then we have a meeting to check up. Do you have any questions? Is there any information that would be helpful to you? Do we still have your commitment that you're going to focus on this, through the budget? Have you talked to other council members? Can you suggest other council members that we should meet with, like that? Because they're all going to take
That's
a
good.
million one-time meetings. If we don't set up multiple meetings,
done right away.
Exactly.
Indiana, that's a great idea. That's a great approach. And who would you say for Sean? Well, no, he spoke to our community board, but he should come to our committee, Sean Abreu. Is there anyone else that you're thinking about? Certainly Sean, because he's our, district city council member.
Are we thinking local or state or both?
I think both. The state plays a role in some of the laws that the hospitals, they have to obey. They're the one that set the standard for licensure.
Okay.
Mm-hmm.
The state person, Laquita, is Rivera. Oh my God, his last name is Rivera. I forgot his first name.
From the state?
Yeah, he's the health. I think he's a senator. He's a health chair.
Okay.
Gustavo Rivera, I think.
We can get his name. let's try to get a letter out. I'm gonna try to get a letter out this week. I'll talk to Barry. Well, the executive committee meets Thursday
It's
too.
Thursday, yeah.
So Edwin, Monique, we could talk to Barry, see how fast, well, it'll come up at the executive committee, so maybe after that we can get a letter
Yeah.
out. I just gotta figure out what the process, since we're dealing with officials, you know, city and state.
Right.
Okay,
Yeah.
okay. Good idea, Deanna. Thank you for that. And I'll be calling you.
Yeah,
You know,
absolutely.
in between me, you know, in between meetings.
Yeah, absolutely.
Okay.
That's just my one tip. And it's, you know, they're all great and they care, but it's just so many issues coming at them at once that if you can set up multiple meetings at the start, that also gives them the heads up that we're like on it.
Yeah,
And
the
I think-
sticky
and I
wheels gets the grease, right?
Yeah, exactly.
Uh-huh. And then the other thing too, if we know of other advocacy groups in our area. I mean, I know agencies that are paid and they're doing a lot of work, but and I can get them here, but there are other advocacy groups. I'll look at WHDC's list to see the other 7 health and human services groups that have not presented to us, and we can get them here too. Because I think there's, you know, the numbers, it helps to have a really kind of like a lot of people in this kind of a shout of force, you know, not in a nasty way, but forceful enough where it makes sense. You know, we make some recommendations that can make some sense and be supportive of our communities, the families, and the actual person in need of help, the one suffering and playing out that suffering.
I have a question or a comment real quick, and I'm sorry, I just cut someone off and I didn't mean to. Columbia
That's okay.
Presbyterian has the, I mean, I don't know if they have any involvement, but they have the Psychiatric Institute, where I would assume they're supposed to render mental health services. And I'm curious.
Remember when
They
Victor,
do.
yeah.
They
when
do. They
Victor was
have
talking-
a program for very mentally ill people that's like free, but I think that budget's being cut. Yeah, they do. But what I wanted to say is Bronx Works prepared a paper for Eric Adams' transition team. It's in that article about Bronx Works.
Oh, yeah, no, okay.
It's in the article about the mental health system in New York City. We need to see who authored that and to have them come and talk to us to see.
That's a good idea.
Where we could really work.
Thanks, Monica. That's a good idea. Is Bronx Works connected to Sobro? Do you know?
No, not at all.
Okay. Okay. And then at Columbia School of Medicine, Monique, you were saying which group?
I just said that I know they have the Psychiatric Institute. I don't know what the specific group is up at the Psychiatric Institute, but I mean, that's one of their main programs up there. And certainly they should be rendering services. To what extent, I'm not sure.
Okay.
But the Psychiatric Institute.
Yeah, and I think that, you know, the issue is that we have a capacity problem.
Okay.
It has to expand. You know, they could be providing the service, but it's not enough for what the community, you know, is demanding.
Yeah.
When you go and you speak to the primary care providers in our community, and you ask them, how long does it take you to send one of your patients for a psych visit? That gives you a understanding of what's going on.
Yeah.
It's very different in the other areas where a lot of money is being made. But you know, what is a societal cost that we're willing to offset to trade off, you know, a profit-driven healthcare model, and then having folks dealing with a serious health issue.
Great, Edwin.
That's true.
I don't know if I should ask you to follow up with that, because I know you're busy working on your doctorate. But I could try to reach out unless you feel it's something you might be able to do. See who the contact is, and then I could follow up. If not, don't worry about it. I can do it.
Oh, sorry.
Go ahead.
I'm sure.
Monica's hand is up, and then Edwin. Oh, now I see Edwin. Monica, and then
No, I can't. I'm having all kinds of problems.
your hand keeps going up.
I think in the program that Reggie is running, he probably knows some of these clients that they tell him or his staff, look, I can't get an appointment so I can get my medications. So if any of these clients, they feel comfortable, they don't have to put their pictures up or video, and they can just give a testimonial as to their experience navigating, trying to get mental health, because folks, they think, well, it's therapy, it's talking. Yes, it's that. And also, following up on the treatment plan that you're getting. And that can be an issue.
Edwin, I think I would talk to, a couple of days ago, I had a meeting with, some of you may know, Dr. Hankerson, Sidney Hankerson. He has he just left Columbia. He's in transition from Columbia. He's a professor at Columbia, and he runs the Hope Center on 130th Street, which is a healing center for mental health. And he is going to Mount Sinai. And he also has a group in Harlem, Community Coalition for Mental Health. I would probably talk to him about that. Maybe we could do something, collaborate on something. Tell me exactly what you'd like, give it to me in writing, and let's see what we can do.
Okay. So
I also, there's two other things. I just want to say, it's really been a pleasure dealing with Joanna Castro. She's a pleasure to work with because, the reporting, and she just has a lot of patience, and she's just a pleasure to work with. I just want to give you some feedback on her. And the last thing is, how do I, there's supposed to be a record form, an attendance record form. Do I talk to you later about that, Laquita?
Oh, we can just show that you were here. We had to do that for a couple of other organizations too.
Okay.
Reggie, does anyone else need it? Because Victor and Barry, Barry's our chair of the board, Barry Weinberg, and Victor Edwards is vice chair. And I know Victor had to do a couple recently. So either one of them I could talk to about doing that, because our district manager is out for a little while, medical leave. So we can get that done. Anyone, is there anyone else who needs that? No, probably just the two of you and Stephanie. So yeah, I can get that information. You do the letter, and then I'll send you their email address.
Nikita, is this to say that they came to your meeting?
That they were here.
Well, it's the standard form, and they have it, and they just give it to you, and you sign off on it.
It is okay. I didn't know. I heard it for the first time.
Form. It's already printed up and everything.
So we just need to let Victor or Barry know that they need it.
Basically, it comes from West Harlem Development Corp. It's their form they send to us. So ask Zeta, and we fill in what meetings they were at. And this all the meetings, and you just check off what meeting they were at, and you can sign it as the chair of the committee.
Laquita, we've been doing this for a while. Yeah, it's what
Marita I do
just
it for my committee all the time. Yes.
Yes, we've been signing them for years, Laquita. You just sign it. They email it to you a PDF, and you sign it and email it back.
That's it.
Who has the form? I didn't hear that part.
The grantee will send it to you.
Okay, so Reggie just send it to me, and Stephanie, if you're still on, if you need it for this meeting, just email it to me.
Okay. I get it from your website, right?
No, you get it from the West Harlem Development Corp.
That's not what they say. Here it says CB9 attendance form. Okay, okay, yes,
Yeah,
I think I
you
do.
get the
I
blend and
do,
give it
I
to
do.
them and then we
Okay,
sign, yeah.
I'm getting old,
Okay.
sorry. Yes.
Okay, because I heard it for the first time a couple of weeks ago, actually from Stephanie, so it could have been a lot easier on her. But okay, no problem. Just email me. I think you all have gotten emails from me, so just send it to me. And this has been a terrific conversation, our meeting, and we will be following up on the suggestions. So stay posted, stay tuned. New business, our new business was just with the CBA agreement, and we just have to really see how we follow up with that. And if you guys can email me, we'll have a discussion again on it next week. And maybe even before that, so that Edwin and Solomon and Monique, if she goes, will have something to report on from the Health and Environment Committee. I'll be in touch with each of you.
Victor had spoke very positively about the section in it, I think 24, whatever page to look at. So he addressed that very well.
And it's yes, and it's what he wrote up. Well, actually, he didn't write it. He sent it to everybody. It was pretty thorough. Just look at that last email I sent, and a copy of it is inside that.
Right, that takes care of that.
Yeah, okay. And then with the old business, any old business, anyone or that it can wait, I suppose. Maybe next month we can hear from any reports on whether the Cannabis Task Force, the Serenity Committee wants to talk next month. And then, of course, we'll have another follow-up dealing with a mental health issue and approach.
And the staff issue of cyanide too.
That's you know what? That's the Serenity Committee.
No, with the staffing issue?
I was thinking the nurses.
The nurses, yeah, with the staffing issue.
Yes, we need to, okay. Edwin, if you give me or text me that information, I can reach out to them.
Yeah.
Yes, please send me that. You've been so terrific about keeping me abreast of who I need to follow up with.
And speaking about mental health, they were one of the ones that talked about their own mental health as well, which renders them unable to render care because they're going through a crisis.
Which is why so many nurses and all haven't gone back. They've been under such stress.
And they were talking about the ER and what was happening there and how, you know, yeah.
Okay, and then if you have a copy of the resolution we did or we signed for them, I would appreciate it. I know that youth is out, so unless you can find it.
Yeah, I have it. I'll send it to you.
Oh, okay. Well, okay. You sure you have the right one, Edwin?
Yeah,
we did. I have it, guys.
No, I was gonna say Miriam and I worked on it, so I was.
Maybe Miriam can send it.
Yes, you guys. I did work on it.
Yeah.
Okay, so if you have the most recent one, Miriam, I'd appreciate it. Just
sure,
so.
Rita.
Thank you. And so let's see, that's old business. I think that's it with old business. And then Miriam, just let me know if you want to be put on the agenda, with cannabis next month, if you all have anything.
Yes, Miriam. I'm looking at her.
Okay, and let's see what else. That's it. So can I get a motion to adjourn?
I motion that we adjourn at 9:07. Would somebody like to second that motion?
I'll second it.
Miriam seconded it.
Okay. All right. Thank you.
Bye.
Thank you. Nice meeting everybody.
Edwin, before you get off.
Nice discussion, everyone. Good night.
Good night.
Yes, it was. Thank you, Monique.
Take care. Take care,
Laquita. Recording. Can you get everything off? I got as much of the chat off as I could. Some of the Solomon was sending a lot. I don't know if Solomon's still on the phone or not. I mean, on the Zoom.
I'm grabbing the chat. Don't worry, I'll send it to you.
Okay, great. Because trying to listen, make some notes and take down the chat. So that'll be good. Okay. And Solomon, you know when strategic planning meets?
I do. I usually
It's 2 more
attend.
weeks, I guess. Yeah, okay, so you're our rep. And Edwin. Okay, and Edwin, if you send me the, because I hopefully I'll have my computer up and running by the end of this week. I got the new computer, but it locked out. The Surface laptop, it's got these I'm just totally locked out, security, you know. So anyway, can you send me the minutes as they were the recording like you did last time?